When I was 15, I was diagnosed with acute lymphoblastic leukemia. Through my treatment and seeing many of my friends at the time treated, it inspired me to move on and make a difference in that field myself. Hi Julia, how are you going this morning? I really enjoy being able to see a patient in the morning, come back later into the laboratory, do some work, and then spend more time with the patients and having that holistic approach or the direct patient care. The great thing about my leukemia treatment was that I was cured of my leukemia, but I suffered quite a number of side effects at the time, both directly, such as nausea, vomiting and infections, and in the long term, such as a brain tumour I had a couple of years ago, directly as a result of my chemo and radiotherapy treatment. Fortunately now, and due in part to the work of people such as Professor Don Metcalf here at Walter and Liza Hall Institute, these treatments have been markedly improved by making new targeted therapies that are much more specific towards the cancer cell and less toxic to the other cells in the body. Training as a doctor was quite intensive. I spent a lot of time looking after patients with various blood cancers, and one of the things that frustrated me the most was, whilst we could make a big difference to some people, around 50% of people who have acute leukemia as adults still die of their disease. One of the most exciting moments was when we found that a combination of this novel drug with a standard chemotherapy agent but at a very low dose was able to cure a model of lymphoma, a common blood cancer. And that work has led to early clinical trials here in Melbourne and internationally.
So I guess what's exciting about Kylie's research is that in 10 years' time or in 20 years' time, someone might not have to go through the same things that I'm going through now, being away from home for so long and dealing with the fatigue and the nausea. There might be a much quicker treatment regime than what's available now.
The L'Oreal Fellowship would enable me to travel overseas to present my work at an international conference and collaborate with colleagues, as well as provide me with the assistance of a research assistant in the laboratory to grow my work at a faster rate. We hope that this will make a big difference for patients currently with leukemia. However, in the long term, we hope that these drugs can be applied to a broader range of cancers, such as lung cancer and bowel cancer, for example.